Okay, it's my pleasure today to sort of start the day with something perhaps a little less up in the sky and a little bit more pragmatic. I want to talk to you about a continuation from a conversation we started last year at Partnership and talk about some of the work that's actually gone on, taken place on the ground over the last 12, 18 months. And I think set the stage for many of our concurrent sessions later today that have a little bit more detail. So entitled the session, Clinical Interoperability Action Plan Progress Report. So doesn't that feel like what we do at work every day, our progress report? So this is literally to report to you on some of the activities that we jointly decided to do and where we are in the process of trying to accomplish some of those goals. Let's see if I can make this work. So let me quickly remind you of what the Clinical Interoperability Action Plan is. Back in 13-14, we went across the country and did a number of regional consultations, and the question on the table was, what's it going to take to accelerate interoperability? Michael talked yesterday about that iceberg analogy, and we'd done a lot of work on the iceberg under the water, and now we all wanted to see more people using the infrastructure that had gotten built, and we wanted it to be more visible to clinicians and patients. But man, it seems like it's really hard to make that happen. And so we said, what's it going to take to speed things up? We compiled all those ideas into a document about this time, maybe September last year, called Accelerating Clinical Interoperability, A Path Forward. So that was the 30,000-foot strategy document. And from that, we said, okay, so that's nice. Now, what are we going to actually do? So we convened a committee. We called it the National Clinical Interoperability Steering Committee, some wise people, many of whom are here today. And with their help, we crafted something we called the Clinical Interoperability Action Plan. And the idea was that that plan would sort of have a 12 to 18-month window. So it would pick a few things that we would try and tackle together, and then we could add more things to that as we go. So that action plan launched around May, June last year, around the eHealth timeframe. We posted it for public consultation, and we've been working on it ever since, assisted by a number of new resources, including InfoCentral, which you'll be tired of hearing about by the end of my talk. So just an aside, these are the esteemed members of our Clinical Interoperability Steering Committee. I can't thank them enough for their leadership and help over the last year. Many of whom are here in the room, many of whom you heard from yesterday or you will hear from today. So just turn around and smile at them. The idea is that this committee will refresh with new people, and we do have a number of people coming and going this year. So by the time we stand here in front of this group next year, there'll be some new faces on this group, but some existing faces for continuity. And you'll notice that we have the private sector community here, we have clinician leaders here, and we have many people representing jurisdictions and health regions too. And of course, all areas of the country. I'm just like Justin Trudeau when I pick a cabinet, right? Oh no, I don't have 50% women, that's not gonna work. Better go back. So this one slide is in the action plan, and it summarizes the things that we said we would try to accomplish or work towards over the next 12 to 18 months. And at the top is the mission statement. A couple of people mentioned yesterday the definition of interoperability, and they talked about the HIMSS definition. And, nod to Glenn, took us down the path of technical interoperability versus semantic interoperability. On purpose, we did not go with that definition of interoperability. Instead, we really focused on the phrase effective sharing of clinical information among healthcare organizations, clinicians, and their patients. That was very deliberate, and it's very helpful. Anytime someone says to me, is that interoperability? I say, is it sharing of clinical information? And if the answer is yes, then we call it interoperability and get on with trying to do what we're doing. So the action plan had three major themes: mobilizing the industry, which obviously means creating the demand for that above the water iceberg segment. So if clinicians aren't asking for that shared data, if patients aren't asking for that data, then it's very unlikely that we in the eHealth community are going to affect widespread adoption and use of that data. So mobilizing the industry was around getting people talking about making this happen. And then it's a very big universe, interoperability. So the idea was to pick a couple of themes that we thought we could make some progress on. So we picked 3 big buckets: medication management, public health surveillance, and coordination of care. And then within those buckets, we actually picked 4 specific themes: medication reconciliation. You'll start to see some resonance with the agenda for this conference. We had a big theme on MedRec yesterday: electronic prescribing, immunizations, and consult management. So if you look at many of our concurrent sessions, you'll see those themes echoed, because those are the 4 areas we thought we would get to work on. And lastly, a major role for Infoway, some thought leadership, some tools that everybody can use, trying to connect the dots between all the disparate efforts across the country and to foster some sharing, and we called that leveraging enablers. So for our progress report today, I am going to update you on 1, 2, and 3. So again, this is straight from the action plan. We talked about how we get stakeholder participation, that would be you, stakeholders, to seed, engage, produce, and promote the use of common approaches to interoperability. Outreach, if you want to create demand, you have to get yourself out into the media and the mainstream universe where people connect, not just the eHealth universe. And lastly, we had this notion of maybe a brand under which we could talk about all this activity related to clinical interoperability. So I mentioned InfoCentral very briefly earlier. How many of you have been on InfoCentral? Oh, you're the A team, that's for sure. Okay. So InfoCentral launched January of this year. So it hasn't really been around that long. The idea was that it's the best way to get people to collaborate is to do what we're doing right here, is to bring people into the room and let them spend time together. It's not always possible. We wanted to build a modern online collaboration space, and it's a work in progress. And if you have ideas, talk to Mario Voltolino over there. Work in progress, but we're very excited that we were able to stand up something net new, and it's all designed around the concept of collaboration. The idea is that people come together in virtual communities. You can see from this slide, we have already quite a few communities. It's an open platform. So if you have a group related to interoperability that you would like to convene virtually, all it needs is a volunteer leader and some time and effort. And so I really need to take this time to thank each one of these communities has somebody, many of whom are in the room, leading the charge and leading the conversation and stimulating the conversation, trying to get people virtually to come online and talk about areas of common interest. And some of those communities, the communities are pretty high level. So they're actually, these existing communities are really good places if you want to start a conversation about a specific topic, because they're broader, more people convene there. If you start your own very narrow community, sometimes it's hard to get people to come. But once a community gets working on something specific, they can spawn or foster a working group. And so we've done that in the immunization space, for example. We have an immunization interoperability working group sponsored by the public health surveillance community. And so success next 12 months will look like lots more working groups working on a specific project, and when they're done, the working group can collapse back up, and that work can be maintained by the community itself. So if this stimulated your interest, we do have a session later this morning, and we've asked a number of the community leaders to talk about the good, bad, and the ugly of communities. We've got lots of things that are going well, some things that aren't going so well, so we'll get a chance to hear about how that works, and a good opportunity to ask some questions about if you work within a group. It's perfectly acceptable to have a jurisdiction community operating on InfoCentral, a project team operating on InfoCentral. And although they're open, we can also make closed communities if you want to limit the membership of those communities. So it's a platform available for your use. In order to drive traffic and interest, we've added an editorial stream. So again, thank you to all of you who have already submitted editorials. And an offer. Anybody have an opinion about something related to interoperability? Send us a 500 to 800 word treatise on your favorite topic within the interoperability, and we will post it on our editorial stream, and we try and change it up quite often. So I also talked about media, mainstream media or industry-specific media, and so we have made a very specific effort to be talking about clinical interoperability and educating people about interoperability through the publications that they would come to, and so this is just a selection of some of the recent publications. And again, if you hear of opportunities or you like to write articles that we can then get placed in these particular publications, that's part of the strategy and under the mobilization umbrella. And now we're to the brand piece. So I think most of you know that there has been a very successful brand in our community called the Standards Collaborative. And the Standard Collaborative predates Infoway. And certainly in the 8 or 10 years that Infoway hosted Standards Collaborative, this was the mandate. Establish standards for Canada, provide services to support and maintain those standards, and be a key liaison coordinator for Canada's interaction with international standards organizations. All very important roles. But when we went out and did that consultation on accelerating interoperability, we kept hearing the feedback that standards are critically important. Can't do interoperability without standards. However, success in interoperability involves so many other things. I don't have to really tell this group that. So the phrase that kept getting used was standards are necessary but not sufficient to drive interoperability. So as some of you know, long, painful, tricky discussions, we made the decision to retire the Standards Collaborative brand and replace it with a new all-inclusive brand that talks about the broader effort that we are all doing to accomplish interoperability, inclusive of standards, but wanting to make sure that when people came to the table, they were talking about all of those other things: privacy, data sharing, governance, legislation, etc., specifications, implementation requirements, etc. And so guess what? Today we're announcing our new brand, the Digital Health Alliance, with the little tagline for clinical interoperability, which of course leaves the door open that we can use our Digital Health Alliance for some other things. And lots more detail to follow, but that's a new logo, new brand. Thank you to the steering committee who provided us lots of feedback, and to the marketing communications folks at Infoway. And to commemorate the fact that you were here for the launch of this new brand, you can see the mugs that are sitting in front of you. They have the new logo, and you can take those with you today. So, mobilizing the industry. We certainly are continuing to work on the stakeholder engagement piece through the media, through bringing people together under the InfoCentral umbrella, continuing with our partnership conference, and of course, a new brand, because there was lots of activities going on, but we didn't have a way of saying, are you participating in this thing under which all these activities took place? So that is the summary progress for mobilizing the industry. And I'm just going to say a note to our AV guys, my countdown timer is not counting down here, so I have no idea how much time the first third took, but the other two sections are shorter. Oh, there you go. So the second section was collaborate on aligned priorities, and I already told you about some of those priorities. This is the hardest thing to do. Everybody's working on their own priorities, and the idea was to find some priorities that resonate in multiple places across the country where there's an opportunity to get some alignment, some standardization, and therefore some acceleration of the rollout. And there's a lot of activities going on here, and so I'm not going to tell you about all of those activities. I wanted to highlight one thing, and that was a new idea that we talked about a lot during the strategy, and that was clinician requirements or clinical requirements. And if you see the action plan, you see the word clinical requirements. So in the last 6 months, we've developed a framework for what we call clinical requirements. And again, we've talked about standards. Well, the idea here is that for these common interoperability problems, is there a set of requirements that could be published and shared, frontline clinician voice requirements that would be persistent between different interoperability projects? So not just standards being used across projects and not just technical use cases, but actual clinical voice requirements. And the thought was that clinical requirements might help reduce variation across different implementations. The idea being if clinicians could see what one project was trying to accomplish and understood in their voice what that was trying to accomplish and react to that, that perhaps we wouldn't get off track so early in our projects where they diverge and we get slightly different implementations because our clinician advisory groups require their voice to be heard, and they don't have anything to react to because all of the artifacts tend to be the technical artifacts. So that was the hypothesis. So I'm pleased to tell you we've done 4 clinical requirement workshops. We have 1 scheduled next week. After next week, we'll have done clinical requirement workshops in each of our priority areas. Some of those are already published on InfoCentral for those of you who want to take a look. I would suggest that these requirements workshops have exceeded the expectations that we had and the participants had. So picture 25 frontline clinicians from across the country saying, what would need, when I do an immunization in my EMR, and if you want me to share that with a public health immunization repository, here's what I'm willing to do, here's the impact it's going to have on my workflow, here's what data I collect today, that kind of thing, collected again in their voice. And so I encourage you, if you're interested in this topic, to either talk to Sue Seppa or Tanya Achilles, who have both done incredible amounts of work to pioneer this framework that we can hopefully use and reuse, or go to Mario's session later this morning. I think he's going to show you some of the work we're doing in immunization end-to-end as a way of featuring some of the tools we've got. So on our 4 priorities, we certainly have established InfoCentral communities for each of those 4 priorities. We have just about finished publishing clinical requirements for all 4 communities. And now comes the fun part, taking the standards we have and moving them into specifications and APIs that get used in more than one implementation, right? The goal of standardization around implementation. So we have some APIs, certainly from our existing implementations of the infrastructure. Certainly lots of those in the drug space, so lots of pharmacy vendors and EMRs have used some of our APIs to support connection to the drug information system, but we're hoping to do a lot more of that in the months to come. And the third and last section is enablers. So this stuff, more traditional Infoway. The action plan suggested that we work on 5 or 6 themes related to best practices. So the first of those, you'll get the first view of that later on this afternoon. Alvaro Mestre is going to talk to you about, at the time we said, in the action plan we said we want to do health information exchange best practices. We contracted with Gartner and we ended up with 2 deliverables. Leading practices, not best practices, for health information exchange, and a draft maturity model that you can take a look at. So again, thanks to many of you who served on an advisory committee for that and influenced some of the ideas, but you can get your sneak peek today, and then over the next couple of weeks, we'll be doing some webinars and we'll post the entire document, all, I want to say 200 pages, for those that like reading that stuff. What's slowing us down is translating all 200 pages. So that's the first of the best practices. The one in the hopper right now is data sharing agreements. So we heard a lot that people could learn from each other around data sharing agreements. So those of you that attended that session yesterday got a sneak peek on some of that work, but that will result in another best practice leading practices paper on, you can look to Joan Rock, our Chief Privacy Strategist, who's leading that effort and was presenting it yesterday. So that's the next one in the hopper, and we've got 3 or 4 other ideas. We're just trying to get to them. Now, I mentioned standards earlier, and I didn't want to leave the podium without talking about that mandate that I referred to earlier. So the Standards Collaborative put Canada, I think, on an international stage with respect to standards. And Canada is extremely well respected in this e-health community, and it's definitely not because of something I've done, but because of the huge contribution and commitment a number of you have made and others. But I did want to reassure you that all of those things that we talked about in the mandated Standards Collaborative are still going on. So we continue to license SNOMED, for example, on behalf of Canada, and act as a national release center and distribute a full release of SNOMED twice a year and a Canadian extension for SNOMED. We can just about to sign another 2-year agreement to represent HL7 in Canada, and we continue to support and maintain all the pan-Canadian HL7 standards that so many people have put so many hours into developing. Canada continues to be the biggest contributor to LOINC through Regan Streif, the lab standard, and to release a Canadian version of that. I've been sitting on the board for IHE International representing Canada and continue to think there's some huge opportunities for us to leverage more from the IHE side. And with the help of Don Newsham, who's here somewhere, we've been on the stage at ISO in the eHealth working group. And a number of folks who participate in that are also here. So we're continuing to coordinate Canada's activity on the international stage. And increasingly, as we're not the only people talking about interoperability, the discussion has been, well, when I go to do a solution, I don't need a standard from HL7 and a standard from SNOMED. I need an IHE standard with some HL7 components, some ISO components, and some SNOMED components. So even the international standards organizations are trying to find ways to work more closely together. And I think if you come here, Don's suite, a little later this morning, you will hear more about that effort. And I should also recognize Don and Shelley and thank them for not only supporting the conference, but coming all this way to participate. Don just wanted to come see how we did with this conference because he ran it a couple of years ago. So where do you find all those standards? On InfoCentral, your one-stop shop for all your interoperability solutions. So you can not only download full sets of the standards there, but you can browse and search for things you need, which are very exciting. So all on InfoCentral. And last but not least, thing that I may be most proud of because our team has put so much work into a suite of interoperability enabler solutions, technical solutions to support interoperability. And we put the last chink in that this year. If you go to Mario's presentation, he's going to try in half an hour to give you a flavor of all of these. But from InfoScribe, which was new this year, which is our publishing mechanism for these clinical requirements, and then what we're trying to do is give the ability to build and publish specifications, implementable technical specifications that can be tied back to those clinical requirements. So InfoScribe is our first version to try and do that. Message Remixer to help people working with those complex HL7 v3 standards. Message Builder API to help implementers work with those complex HL7 v3 standards or CDA standard. HL7 Explorer to let you browse those complex HL7 structures. And our newest Terminology Gateway, which some of you may have been able to see outside yesterday, and if not, go at lunchtime today, and our brilliant young programmer, Sam C., will be happy to show that to you. Terminology Gateway is going to be very important. So that's a way to take value sets that are specific to your implementations and publish them so people can discover them, browse them, and more importantly, API so they can incorporate those different value sets into their applications. So imagine you're implementing immunization reporting and you need a list of vaccines, and that list of vaccines is going to change and be updated a couple of times a year. How are you supposed to acquire that national list of vaccines and work with it? And Terminology Gateway is a tool to be able to do that. And how do you access all these tools? InfoCentral. So it's your launch pad to actually get access to every one of these tools. And that's, don't ask me detailed questions. Go talk to Mario, Sam, or Attila. They're all here. So on the enabler side, we have our first best practices document. We've got one in the hopper on data sharing agreements. We launched our new Terminology Gateway, and we're continuing to maintain our service level agreement around standards distribution. So that's what I really wanted to share with you today. Progress report on the action plan. To remind you that we want to refresh that action plan. Continuous improvement, we can add some more clinical priorities, we can add some more tools. If you've heard of a third-party open tool that you think needs to be on InfoCentral, we can point people at it through InfoCentral. We need to do more mobilization and activities. And in general, help do whatever we can from Infoway's perspective and we can do as a community to accelerate interoperability.